Hello everyone, welcome back to the Tokyo Living Podcast. Today we have our resident physician, Dr. Tom Lomax, joining us live for the first time. Tom, thank you very much for making the 7-minute walk down from Tokyo Medical and Surgical to our location. Obviously we know you're an extremely busy man and we appreciate your time as always. We'll dive straight into the topic for today. We've got you on to talk about testosterone replacement therapy.
Yes.
Now, this is something that has gained a lot more, sort of public attention over the last 5 to 10 years. And as a health practitioner, it's something that I know I get quite a lot of questions about, and no doubt you do as well. And because you're someone who does prescribe TRT for appropriate patients, I thought it'd be good to get you on and talk a little bit about your understanding of the current sort of evidence behind it, and also the way that you go about using it with patients. I thought it might be good just to go back to the basics for the viewers and listeners and give a very brief description on what testosterone actually is, its functions in the body, and how certain aspects of our lifestyle might affect the endogenous production of this hormone.
Yes. Okay, so I mean, it's described as the male sex hormone, but actually testosterone is present in men and women, but just at much higher concentrations in men. Basically, testosterone is why men generally run faster and hit harder. So it stimulates production of red blood cells. Men have typically about 15 or 20% more red blood cells, which means we can carry a bit more oxygen, which is useful for things like sprinting, and also have slightly higher muscle bulk. And those are testosterone dependent. So lack of testosterone will generally cause those things to fall, but it's also responsible for libido. Yep. So low or absent testosterone will cause your libido to fall, and that happens in women as well as men.
Yeah. And what happens to testosterone levels over the course of one's lifetime?
So your testosterone is going to sort of peak in your late teens, and it's going to drop about 1% a year on average between 20 and 70. Okay. So by the time you're 70, it's about half what it was when you were 20. Yeah. Although there's quite a lot of individual variation on that.
Yeah. And does one's lifestyle play a part in that variation in terms of testosterone levels?
Yeah. So there's a lot of different inputs into testosterone. I think the one that's probably overlooked but actually has the biggest input is kind of your psychosocial sense of well-being. So if you're stressed, sleeping badly, overworked, or particularly if you're in a bad relationship, your testosterone is probably going to fall as a consequence. There are some other physical inputs as well. So some dietary deficiencies, low vitamin D, will cause your testosterone to fall. And obesity as well. Obesity has a clear and marked impact on testosterone because fatty tissue tends to produce extra estrogen, and that will kind of counteract the testosterone. So guys who are not overweight so much as obese, a BMI of over 30, will tend to have lower testosterone.
If you maybe you are obese and you're doing all the wrong things, poor sleep, stress, or maybe you're in a bad relationship, and how does the chronic effect of those things affect your long term? So if I go through a period in my 40s where my lifestyle isn't great, how's that going to affect how my testosterone levels look when I'm 60, 70?
Those are all sort of correctable. Okay. So if you're stressed, overworked and overweight, your testosterone will fall. If you go in and fix all of those things, which is often easier said than done, your testosterone should sort of come back up again. I'm not aware of any evidence that if your lifestyle causes your testosterone to be low for an extended period of time, that it won't then respond to improved lifestyle. But that's very hard to prove. Yeah. So if you've had all those problems for 10 years and you fix them, is it guaranteed your testosterone will come up? No, probably there's an individual response to that.
Sure. And so what's sort of the history of testosterone supplementation?
It's been around for decades, so this is nothing new, but it's certainly become commercialized, much more widely available, and marketed in the States a lot more heavily. So when I last checked, something like 4% of men over 40 in the US are on testosterone replacement.
Wow.
And that's probably been driven to some degree by direct marketing to consumers, which drug companies are allowed to do in the States, but not in most other countries.
Yeah.
So if you go and switch on the TV in the States, you'll see ads saying, you know, have you checked your T? Do you have low T? And it'll be sort of pictures of guys like lifting heavy weights and looking amazing because they're on testosterone replacement.
Yeah, yeah.
So, I mean, that could say it's been overdone in the States. Having said that, a lot of those guys actually do feel quite a lot better.
Yeah. So is that correlated with what you've seen in terms of, you know, people coming in with questions related to TRT?
TRT is quite complicated, so I think you've got to know who to test, how to test them, how to interpret the results, and then how to treat the results. And if you don't get those steps right, then there are quite a lot of pitfalls. But if you do, if you identify people who need to be tested, they do genuinely have low testosterone, and you replace it, they pretty well do feel a lot better, actually.
Yeah.
So, I mean, it is an effective therapy, but it just needs to be used and not misused.
Sure. And so, yeah, who is the person that you would deem appropriate for testing?
So again, if you sort of look at the ads, it's like, do you have fatigue, irritability, poor recovery from exercise, poor sleep, low mood, low libido? Well, I mean, most of us will have at least one of those most of the time. So definitely not all of those people need to be tested. Yeah. The sort of top of the hierarchy is low libido. Okay. So guys that are just not interested in sex, that's probably not right. Yeah. And I mean, the sort of, if a guy says one thing that makes me think, okay, he needs to have his testosterone treated, and it's probably low, it's my partner wants to have sex and I'm not interested. That's the sort of go straight to check the testosterone statement. I mean, otherwise, guys who have sort of some of those symptoms to some degree, you've got to exercise a bit of judgment, and you've got to decide, you know, are the symptoms severe enough? Have they been present for long enough? Is anything else going on? Because obviously other medical problems or other social problems can cause some or all of those symptoms.
Yeah, sure. Do you have any sort of cutoffs in terms of age or BMI that you're looking at? Like,
no, I don't, because I mean, I've had people who've been obese, you know, significantly overweight, and they've had very low testosterone. And if you sort of tell them, well, your testosterone's probably just low because you're overweight, go off and lose the weight and everything will fix itself, they really struggle to do that because they're generally, you know, fatigued, they can't exercise very much. So, I mean, actually, if you identify and appropriately treat those guys, fix their testosterone, then their sort of body condition improves a lot, and they tend to, you know, drop, certainly they sort of drop fat. I mean, they may kind of increase their lean weight. But obesity is not a bar for testosterone treatment.
Right.
It's just you need to consider it. And in guys who can and want to drop weight before they're put on testosterone, that should probably come first.
Then normal ranges for testosterone.
So, I mean, before we get to that, it's like, what are you going to test? So particularly in Japan, there's been a big trend to test free testosterone instead of total testosterone. Okay. I mean, historically, total testosterone has been used much more to guide replacement because robustly, it's a reasonably good indicator of testosterone levels. Yeah. It's relatively easy and relatively cheap to measure.
And would you just, are you able to explain the difference between total and free testosterone?
Yeah, so, I mean, if you sort of took out some blood, there'd be a certain amount of testosterone in it. A fairly high portion of that testosterone is bound to proteins that circulate in the blood, 2 or 3 different proteins that circulate in the blood. So it's not doing anything, it's just kind of sort of sitting there in reserve. When it unbinds from proteins that are in your serum, then it can hit the biological targets. So that unbound testosterone, the fraction that's just floating free, that's actually doing the work. Okay. So obviously it sounds much better to measure the free testosterone, but it's technically very difficult. Okay. And a lot of the lab tests that are used to measure what's described as free testosterone are actually very unreliable. So historically, labs will say, okay, we're measuring free testosterone, but their numbers are all over the shop. There's one kind of reliable method of testing free testosterone, which is called equilibrium diffusion testing.
Okay.
It's getting a bit too technical here, but if you're not using that, the number you're getting is actually quite unreliable.
And that's not commonly used?
It's usually only available in, kind of research or quite high-end settings. Most commercial labs don't use it.
Okay.
So the results they're generating might be questionable. So generally the advice is total testosterone is a more robust marker. So it's a better one to use, unless you are significantly overweight. So in obese people, it can be questionable.
Okay.
Because their binding globulins change. In people who've got other endocrine disease, like thyroid disease, it can be questionable as well.
Okay.
And in people, I think, over 65. So in people under 65 who don't have another endocrine disease and have a BMI of under 30, generally it's better to go with total testosterone, not free testosterone.
Okay.
If you don't fit into those groups, you do really want to know the free testosterone, but you have to make sure the lab's using the right test.
Right.
Okay. So that's the first pitfall, is using the wrong test. The second pitfall is, your testosterone jumps around a lot. So just measuring it once on one day is not a very accurate marker.
Okay.
So I think anyone who recommends testosterone replacement on the basis of a single test is making a bad call.
Okay.
And I always want to test testosterone at least twice and often 3 times, unless it's kind of crystal clear. So if someone's got really obvious symptoms like super low libido and really severe fatigue, and you do 2 tests and they're both extremely low, then okay, just go ahead and replace them. But a lot of people are sort of in a grey zone, and then actually it is better to measure them kind of serially over a period of time and know really where you're at before you start going into replacement. Because once you put someone on replacement, they're going to stay on it for a long time.
Yeah.
It's not easy to get out of it. So you kind of want to make sure you've done the right thing when you make that call.
Yeah.
And you also want to measure testosterone in the morning as well.
Okay.
So it does fall through the day. So kind of the gold standard is to measure it sort of 8 or 9 a.m.
Yeah. Okay. And so the ranges that people will be in, are you... The decision whether to put someone on TRT, does that depend on their age in relation to the range, or is it?
You've got to look at symptoms, age, and results. So if you just sort of, broadly speaking, in the States they report testosterone in nanograms per deciliter, and if it's under 400, you're potentially a candidate for replacement with some kind of, you've got to look at age and other factors. If it's under 300, probably you should just be replaced, basically, on more than one reading.
Yeah.
In Japan, they report it in nanograms per milliliter, so instead of 400, the number is 4, and instead of 300, it's 3.
Okay.
But it's just a scaling difference.
Someone is within those ranges or below those ranges. Are you talking about sort of health and how are you sort of combining the more holistic piece and talking to them about lifestyle and other health-related things?
We've got to, someone's got symptoms, so they've got like low libido, fatigue, and mood disturbance, and you've confirmed their testosterone's low by checking it maybe 2 or 3 times. The next thing is to have an open discussion about, are there any sort of correctable factors that are feeding into that? So if there are relationship problems, if someone, for example, is motivated to start exercising, they just haven't done it yet, then definitely they should be given the opportunity to sort of correct those things and reassess before you go ahead with testosterone replacement. But if all those things are optimized, so if someone doesn't have any big kind of lifestyle problems, there's no kind of psychosocial issues going on, the testosterone's still low, then it's probably an appropriate time to think about replacing it.
Yeah. And are there any sort of intermediary medications that you might use to have a positive effect on testosterone before that?
There's nothing that's robustly proven. So if you go onto the internet, there's like a billion different things that are used, but the medical evidence behind them is not great. I've heard of some people being given Clomid. I don't really believe in that. I've heard of, well, I guess a lot of people will take DHEA, which is a testosterone precursor. If you've got a lot of DHEA in your system, you probably do make a bit more testosterone. But again, that's not been sort of robustly validated. I personally don't think there's any big problem in guys trying to take a small amount of DHEA for a trial period of, say, 3 to 6 months. I don't see any harm in that, but it's not an accepted medically proven therapy.
Yeah. Okay. What about risks? Are there any sort of common side effects and then more serious reported risks associated with its use?
I mean, the side effects, I've given quite a lot of guys testosterone, and generally the feedback is very good. Most guys just feel much better. So, I mean, often like much better. The one side effect that I've run into is like nipple fat.
Yeah.
So sort of man boobs, and that can be a little bit tricky to treat.
Yeah.
There are some things you can do about that, but for most people that's not a deal breaker.
Yeah.
And I don't see it that often actually, so
Yeah.
I don't worry about that. I think risks is a bit more of a consideration and does need to be taken seriously.
Yeah.
So there's a kind of possible but not proven link between testosterone and prostate cancer.
Yep.
So prostate cancers are male sex hormone dependent. If you've got a prostate cancer, you definitely don't want more testosterone in your system.
Sure.
So older guys, that's anyone over 50, definitely need to be screened for prostate cancer, have their PSA checked. If there's any suggestion they might have a prostate cancer, you need to be absolutely clear that they don't before you go ahead and replace. There's a theoretical but unproven risk of causing prostate cancers, but no one's kind of demonstrated that so far. So
Sure.
I kind of tell people, well, can't prove that it does or doesn't, but you should just be aware of that.
Yeah.
And I guess guys with a very strong family history of prostate
Sure.
cancer should consider that.
Yeah. And then what about cardiovascular health risk? I know that the increase in red blood cells, that sort of, yeah.
So, I mean, if you've got uncorrected risk factors for cardiovascular disease, they need to be corrected. And if you've got vascular disease, so if you've already got narrow arteries from years of smoking and high cholesterol, there definitely is some added risk, which is why it's got like a black box warning in the States.
Sure.
So, I mean, in guys who are, you know, have good cardiovascular health, and maybe you've assessed their health of their arteries and everything's okay, I don't believe that's a consideration. But in guys who've got significant artery narrowing, I would be pretty hesitant to put them on testosterone, actually.
Sure. I'm going to give another example of someone who comes in to see you. Let's say they're a 28-year-old, otherwise healthy male who just wants to optimize their results from resistance training.
Yeah.
What's the conversation you're having with them?
Yeah, I'm not keen. I'm not keen on. Well, I will not replace people to above physiological levels because it's known to be harmful.
Yeah.
So it carries risk of sort of liver damage. It carries risk of thrombosis from too high red blood cells, and again, so guys will say, well, I just want to get really jacked for like a year or two and then I'll stop. But the exit strategy from that is hard, right? Because if you're on a lot of testosterone and you abruptly stop it, things don't look very good. I mean, you feel absolutely terrible because your body has kind of switched off its natural testosterone production, and that can take months to switch back on again. So you're going to feel like you just ran into a wall. Yeah. So, I mean, that's not something that I do in my practice. I know that some people that I see will obtain testosterone kind of through grey routes and will just use it, and I just have to say, well, you're using it against my advice. Yeah. If you make the decision to use it against medical advice, please make sure that you monitor things like your liver function, because there may be some red flags there you need to look at. Yeah, yeah.
Just going back to side effects, I will just anecdotally comment on to my own experience. I have had, and this is fairly rare, but I have had a couple of clients who have started TRT, and it has had an overwhelmingly positive effect on their energy levels and their ability and motivation to exercise, so much so that they've then gone and done too much too quickly and ended up with a musculoskeletal injury.
Tendon injury.
Yeah, exactly. Yeah, they have been
because
tendon
your
injuries.
muscles respond very quickly, so you'll quite quickly gain muscle bulk. and your tendons will condition, but that will take a little longer.
Yeah.
So if you hit the tendons really hard after a short period of testosterone treatment, you're going to bust them.
Yeah. So I guess that would sort of be my my take on it. That if people are starting to do it, making sure that they're easing their way into exercise and doing that ideally under a bit of supervision.
Especially guys over 40.
Yes. Yeah.
Definitely. Yeah. So definite risk. So guys who've been doing quite a lot of resistance training already, maybe less so. But guys who want to sort of get their testosterone replaced and then start doing fairly intensive resistance training past 40 is a recipe for a busted something.
And so what are the logistics associated with this sort of treatment? Is it always by injection, or are there other forms of application? And
It's like 1,000,001 forms available. So theoretically, you can't take it by mouth. I mean, you can, but it's bad for you because it gets absorbed by your gut and then it goes straight to your liver. Yeah. So biological effect is much more variable, and adverse effects on the liver are much more significant from oral testosterone. So no one should be giving that out now. Even like 20 years ago, when I first started my primary care training, that was one of the first things my trainer said is, don't give people oral testosterone. Right. I think that's kind of, people are aware of that now. So, actually, for choice, I would probably choose transdermal. Yeah. So that's roll-on or applied in a patch, but you can't get that in Japan. Okay. Well, there's one exception to that we can discuss at the end. Basically in Japan it's injected, which is a little bit old school. So I've had patients who've gone to the States and they've had like pellets inserted. So you can have these pellets that will release testosterone over like 9 months to a year, which isn't a bad option actually. Yeah. I see them for initial blood tests. They go for therapy in the States, then they do follow-up blood tests with me, and then they go back and have the pellets redone every 9 to 12 months. Okay. So that's fine. In terms of what I can prescribe in Japan, I can prescribe short-acting injections. So that's testosterone enanthate, which you typically inject about every 2 weeks. Okay. You may need to adjust the dose to get the right level of replacement. So in some guys, I'll do smaller doses closer together if they get a lot of cycling. And in some guys, if they're over-replaced, I'll give them doses more than 2 weeks apart. Okay. But that's the basic starting point. And then there's a depot injection called Nebido that you generally have injected every 12 weeks, which is a bigger injection. You have to come in and have that as a muscle shot from one of the nurses, but you only need to swing by every 3 months, whereas the 2-weekly one you have to self-inject. Okay.
And in terms of cost, if people were to do this here or at least through you,
it's not that expensive. So the sort of self-injections, the ones you do every 2 weeks, are like 2,000 yen a shot. Okay. So that's like, depending on what dose you end up on, plus or minus, but you're looking at about 4,000 yen a month for treatment. And then obviously you've got to do appropriate monitoring, blood tests and consultations. But guys who I've got on replacement and who are stable, have good symptom control and no adverse effects, I only see them once every 6 months. They just kind of run their replacement in the background. So the depot injections are imported, they're more expensive. They're like, I think, about 50,000 yen once every 3 months. So they're probably a bit more than twice as much. Yeah. But I don't think cost's a deal breaker for most people, actually.
Sure. Just wrapping up, are there any other sort of considerations that people should know about in regards to this?
We've talked about this as an exclusively male thing, but women can have low testosterone and side effects from low testosterone. So actually Dr. Yeboah does most of the female testosterone replacement, although I do have some patients on testosterone replacement who are women. This is generally menopausal women who have particularly low libido and want to fix it. And testosterone works really well, and we've actually imported topical testosterone that you can give across the skin. It's a very low dose, so it's only suitable for women. Right. But it's basically a little bit of gel that they just apply to the skin once a day. And that seems to work very well, actually. Okay,
yeah. And so how, it's obviously a smaller dose. How much smaller?
It's like 10%, basically. And although, again, you have to sort of vary it, and you have to do monitoring blood tests and get the right dose. But you're starting at about 10% of the level or less sometimes.
Mm-hmm. Anything else people should know?
I think that covers most of it. There are a lot of pitfalls. As I said, you've got to test the right people. You've got to do the right tests. You've got to interpret them correctly. But if you clear all those steps, guys who genuinely do have low testosterone and have it appropriately replaced do genuinely feel much better, in my experience. Yeah.
Okay, terrific. Well, Tom, thank you very much for your expert advice, your very concise and practical information as always. Thanks very much for listening, guys. If you do have any questions or any topics that you would like Dr. Lomax to speak about, please let us know, and we look forward to getting you back on the show soon.
Thank you very much.
Thanks for listening, guys. We'll see you on the next episode.